I've been privileged to be able to do this work for 15 years, which is extraordinary because I haven't aged a day. And I, in these 15 years, to see all of these medication and the medication combinations that have come to fruition for our patients to live longer and live better is just extraordinary. And I put this picture up to kind of start as a little joke that, when the side effects kick in, you'll forget what we're treating you for in the first place. So, like, one of these represents your cancer medication, and all the other represent the medications we're using to treat the side effects. So there's some terminology I'm going to use that we're going to mix in here. So I'm not going to read all these to you just for the sake of time and for the sake of you having to listen to me any more than you already have to. So we're going to talk about why these side effects occur? What are some strategies to address them? What are some of the more common side effects, and what can you do to empower yourselves to manage these side effects? Another caveat here is we could have an entire day's conference on side effect management, so squeezing this into 20 minutes is a little bit challenging, but we're gonna do our best. So why does this matter? Why do managing side effects matter? So treatments can help control cancer for months, more so even years now. So managing toxicities is important in that regard. It helps keep people on treatment longer. So a lot of times what we'll see is, I'll get, calls from peers, across the country about managing certain things. We do a lot of collaboration. And sometimes what we see is that people get pulled off drug too soon when the drug is working well, but the toxicities are just not being managed like they should. And we really want to optimize treatment for people. And most side effects can be controlled or reversed, some not. Some are bad enough that we have to pull treatment. Quality of life, of course, is something that we're always thinking about. And little star next to this one. So with these combination treatments that my partners have already talked about this morning, the side effects can overlap, and it's making managing toxicities a little more confusing and challenging. So how do we keep you safe? Some of these side effects are predictable, some of them are not. But the reason why we spend so much time with folks, especially in the beginning, is because we really need a thorough medical history. Number one, to make sure it's safe to prescribe the treatments that we would like to give you, right? So if you have an underlying condition that might make it unsafe or more susceptible for you to have toxicity, we've got to know that off the bat. And then, as you all know, we run a lot of tests. Good gracious, a bunch of vampires around here, right? So blood, urine, we're looking at your heart, we're looking at your full body. But that's to keep you safe. And we do the same while you're on treatment to ensure that the treatment, while you're actively getting it, is not causing any harm that wasn't there in the first place. Hopefully, we're doing a good job with patient and caregiver education. A lot of our institutions have protocols for side effect and toxicity management that we follow. And we are lucky enough at UNC, and I know the same at Duke, to have specialized staff who are experts in managing specific side effects related to especially some of the immunotherapies. So I really like to set expectations up front with my patients because it can be a real bummer if you come into my clinic and I'm like, hey, we can't treat you today. And if because of X, Y, and Z. And I feel like we as the providers on our side of the street need to do a good job of ensuring upfront, say, hey, you might come into the office one day and you might be having this crummy side effect. And we might have to hold your treatment, whether it's a pill or an IV. We might have to dose reduce. We might have to kick the can down the road. Because if you don't hear that up front, that might be a thing, a bump in the road, it can be a real gut punch because it can be scary to be told that we have to hold your cancer treatment. But I just tell folks that we're kind of always walking this fine line between treating your cancer and keeping you safe. And that can be a really fine line sometimes. So setting those expectations that we might have to dose reduce pills, hold the pills or IV treatments, change treatment or pills, or give a treatment holiday, so a little break just to see if things get better. Why do these side effects occur? Well, so for example, for some of these pills, these VEGF TKIs that my partners have talked about, there's what we call class effects. So this is when the medicine inhibits certain receptors that we know play a role in a very specific process. So for example, VEGF has a role in making new blood vessels. So medicines that inhibit that can make your blood pressure go up. Off-target effects are when the medicine inhibits unintended targets. And the next picture is really going to clear this up for you. Right. Like Is that not just like clear as absolute mud, right? Like why these side effects occur. So these just shows different cell receptors and what can happen if they're targeted by medications. So lots of things, essentially. It's one of my favorite pictures. And no, it clears nothing up. So for immunotherapies, why do side effects occur? Well, there's a range of tissues that can become inflamed on immunotherapy, basically every single organ system. And these medications release the immune system's brakes, which can cause it to accidentally affect the healthy tissue in addition to going after the cancer cells. So certain proteins get blocked that normally prevent the immune system from attacking those healthy cells. So this is not an all-inclusive list, but this is top to bottom. We see all kinds of interesting things, to say the least, with immunotherapy, and I'll get into that a little bit in a later slide. But the important thing is to know, gesundheit, that it can affect any organ system. So one of my big take-home messages is, there's anything going on with you that is outside of your norm, please let your team know, because it could be the sign of something really, really weird. Even if you think it has nothing to do with anything, I would much rather hear from people, as would all the other providers in the room. We'd much rather hear from you than not, even if it has nothing to do with your cancer treatment, because it could. So this is just a little strategy of how we manage these adverse events. So we try and prevent, anticipate, detect, treat, and monitor. So how do we keep ourselves aware of how we manage? So with some of the pills, like I mentioned, the on-target and off-target effects are generally predictable. We do a lot of dose adjustments and modifications. It's very common to do that. Sometimes it's really hard to tolerate the highest dose of the medications. And then we have a lot of pharmacologic interventions for these toxicities. For immunotherapy, diagnosis of exclusion can be difficult to definitively diagnose. We do a lot of dose interruptions and discontinuations, but we don't dose reduce immunotherapies. And then to treat immunotherapy related side effects, if they're like, depending on what grade they are, which I'll talk about on another slide, corticosteroids are the cornerstone of treatment because they suppress the immune system. So when the immune system is going bonkers, we want to bring it back down to earth. So the challenges in managing some of these adverse events, especially in combination therapy, is that a lot of these things can overlap. Sometimes both drugs can give you a rash, or both drugs can give you diarrhea, or both drugs can muck around with your thyroid. Um, we see an increase in frequency and severity of adverse events for folks who are on combination therapy, and it just becomes a little complicated, and it honestly kind of makes us feel a little bit dumb. But we really try and figure it out. So this is where I think medicine becomes more of an art than a science, when we're trying to figure out how to manage some of these toxicities. So this is, no one really needs to read this, but I like to put this slide in here. So these are some of the clinical trials that got a lot of our combination treatments approved. And why I threw this sciencey slide in there is because it shows what are not insignificant percentages of toxicities, percentages of patients who had to interrupt either one or both of their treatments or dose reduce the oral medication they were on. So these are not small numbers. It just goes to show, if this ever happens to you or a loved one who are taking these medications, you are in unfortunate good company, is what I like to call it. So how do we on our side of the street try and figure out some of these toxicities? So timing, I think, is really important. And Dr. Katie Morgan, who's the clinical pharmacist who works on our team, is like a just a wealth of knowledge in helping me figure it out when I have no idea what's going on. So big shout out to Katie and the rest of the pharmacists who work with our teams. We think about timing. We think about dosing. We think about how does the side effect respond if we do treatment. That can kind of clue us into, is it the pill? Is it the immunotherapy? The treatments are different. And then can we re-challenge? The answer is yes with the pills. So we can dose reduce those. But for the IOs, we can't really dose reduce those. So re-challenging depends on the severity of the toxicity and how we're able to manage it. So how do we determine how bad something is? Well, I've walked into plenty of rooms where someone is covered in a head to toe rash. Well, that's bad, right? And then my first question is, good gracious, are you okay? And my second question is, good gracious, why didn't you call me? They're like, "Oh, I knew I was coming to see you." So that's why I drive home the point of please call. So that is clearly bad, but we do actually have a way of figuring out how bad something is. So it's when we use this grading system that helps us determine, can we plug on with treatment and do supportive care? Do we need to hold treatment and do supportive care? Or do we need to do more serious things like sometimes put people in the hospital depending on how serious things are? So going back to my strategies to address these adverse events. So holding the offending agent, determining the best treatment strategy depending on the severity, monitoring for recovery or recurrence of said side effect, and then dose reduction or rechallenging as appropriate. And that's a shared decision making between your provider and yourself and your caregiver team as well. So IRE, so immune-related adverse events. So basically anything that ends in itis is what I say. Any organ system, and the onset of these varies. The initial treatment of these is similar to if we are treating a TKI side effect. So, for example, if you have a grade 1 diarrhea, we treat that the same, whether or not it's from the pill or the immunotherapy. But it gets a little bit trickier when it's grade 2, grade 3, because if we believe it's from the immunotherapy, then we have to start doing things like corticosteroids. So this, for immunotherapy, this is how we grade. So it's basically mild, moderate, severe, and life-threatening. And this just, won't read the whole slide to you, but basically once we get beyond a grade 1, is when we start to hold drug and consider starting steroids, and always best supportive care. I'm very quick to involve the specialist, especially for skin. Good Lord, thank God for dermatologists. I don't do well with skin. I don't do well with rashes. So we have a wonderful team of subspecialists who are very, very wonderful, and always willing to see patients very quickly to help us while we're managing. So grade 3 or 4, adverse events from immunotherapy, always require steroids. Depending on what it is, it might also require biologic agents, which can be given as injections or IV, depending on severity. We always bring in subspecialists for these, and sometimes people have to go into the hospital. So, for example, if someone has a significant colitis, which is inflammation in the colon, and just like copious amounts of diarrhea, you got to come into the hospital for that. Urgent colonoscopies and biopsies and things like that. So some common side effects for the VEGF TKIs are listed here. Obviously, this is not an all-inclusive list. Again, we could have a full day conference about this. And I'm just going to pull out a couple of these to review, and I'm happy to talk. I'll be here till the end. Happy to talk after the conference as well. So I think most of us in the room who prescribe these medicines all feel like cardiologists at this juncture with the amount of high blood pressure that we're managing. But what we do prior to treatment is, if someone has hypertension, make sure it's well controlled. Talk to the provider who's already treating it. We have goals during treatment for blood pressure management. So 140 over 90 is kind of our little threshold there. Um, During treatment, we really want people to be monitoring their blood pressure closely. So we try and get people blood pressure cuffs to check at home. I always know when a patient of mine is an engineer because they bring me a spreadsheet, and it's just the most beautiful thing in the world. I'm like, "Are you an engineer? Have we not talked about this yet?" Because me, I just like I'm like this. Like I'm not an engineer. I just like write it down on paper. But it's really, really helpful to track these things. It's also very empowering for patients too. Has anyone ever been tired from anything? Is anyone tired of listening to my voice yet? So fatigue is the number one side effect of any cancer treatment for any cancer. But when we start combining cancer medicines, so if you're on more than one, that increases this fatigue. People look at me like I have 12 spinning heads when I say where the data lie are exercise. Exercise is the most effective thing to help treat fatigue. And I think some of my patients have actually wanted to like kick me out of the room when I tell them that. I'm tired and you want me to exercise. That's funny. Setting realistic expectations for that. I don't run marathons. I don't expect my patients to run marathons. A little bit goes a long way. Conserving energy. So those of us who live and die by our to-do list, like checking off the things that are most important, prioritizing, good sleep hygiene, massage and acupuncture, I think are really good for fatigue as well. There's nothing wrong with sometimes living life better through pharmaceuticals. I don't work for a pharmaceutical company, FYI, but sleep medications, like if you're getting really crummy sleep, that's just going to affect your entire quality of life. And then treating other causes. So sometimes we make your sleep worse with messing up your thyroid and anemia and things like that. So making sure we're treating underlying causes as well. This was me when I woke up with laryngitis. Hand-foot syndrome, something we see very commonly. So anyone on the TKI pills, we want folks to be on these thick urea creams for prevention. So hands and feet, 1 to 2 times a day, avoiding very hot water, etc. So for these things, we use steroid creams to help treat, antibiotic creams, pain medication, depending on the severity, whether that's a cream or a pill. And my little asterisk here is no bathroom surgery, for heaven's sakes. I've had folks come in who have like used some sort of tool they got out of a barn and like did something to their foot in the bathroom. And this is like what keeps me awake at night. So please, no bathroom surgery. If you have hand-foot syndrome, let us know and we will help you, I promise. That's what it can look like, just so you know what I'm talking about. And then diarrhea, we all know what diarrhea is, so I won't go too much into this, but changing eating habits can be very helpful. Medications can be very helpful. So things like probiotics and over-the-counter. And then I know this seems like really, really, really like a dull moment, but if you're taking laxatives or stool softeners and start having diarrhea, please stop those. And then anything that's an obvious trigger, certain foods sometimes trigger diarrhea or make it worse for folks. Um, but we also want to know if you're having diarrhea before you self-treat, so we can make sure that we don't think it's like an infectious diarrhea, because then that's treated differently. Ah. The goals of managing side effects: controlling symptoms early and effectively, minimizing recurrence, minimizing exposure, long-term exposure to these steroids if we need to treat, and maximizing benefit of your cancer medicine. This is a list of things you guys can do. Help us out. We're a team. Keeping a log of your side effects, reporting new symptoms right away. Do not assume that something is normal. Following the preventative methods that your team talks to you about. Checking your blood pressure if indicated. Don't self-treat. If on immunotherapy, really important to let all your other providers know, just in case you need to be treated with steroids for something else. You can actually carry a little wallet card for that. And don't wait till your next appointment. I would rather you call with a rash than me walk in and see you covered in it. These are just little blurbs about taking care of yourself. I won't read them all to you. And then some key takeaways here are side effects are common but manageable. Early reporting can help avoid more serious problems. The use of combination therapy makes this a little tricky, but we're working on it. The management depends on the severity. Adjusting treatment does not mean that the treatment isn't working. Okay. And stay connected with your team in between visits.